with ourselves and online, so we can go ahead and get started. So I'd like to go ahead and call the meeting to order. And
This conference will now be recorded.
so let's go ahead and call the meeting to order. And we'll have our invocation. Heavenly Father, we ask you tonight to look down on this meeting and these people assembled here, Lord, to do the work of Scotland County and do what's best for our Scotland County citizens. We ask that you be here with us and guide us and direct us as we attend to that business. And we thank you, Lord, for all your blessings and just to have the opportunity to be here tonight. We ask all these things in the name of your Son. Amen. So the new agenda is before you for tonight. Is there any discussion about the agenda? Has everyone had a chance to look at it? Any comments or questions? Do we have a motion to adopt the agenda as it is? Charles? Second? Dr. Baldwin? And the minutes from the April 20th meeting are in your packet, and we need to approve those as well. Have you had a chance to look at those? Any comments or questions? And we need a motion to adopt the minutes of April 20th as they are. Charles? Do I have a second?
Second.
Dr. Bowling? And do we have anyone for public comment tonight? No.
We hear nothing. Oh.
Okay. So it seems that the signal's going in and out. We can see it on the screen here. Can you hear me now?
I can. Yes.
Okay, well, we'll go ahead with the administrative reports. We've adopted the agenda for tonight and approved the April 20th minutes. So Tim, are you up first with the fiscal report or the fiscal update?
Yes, ma'am.
Okay, thank you.
Good evening. This is the finance report as of June 30th, 2021. This is actually the ending of last year's budget. So once again, a reminder of the 10 public health essential services that we are required to look at when we make any decision as far as financial wise for the budget. Oh.
Y'all bear with us, we're experiencing some technical difficulties with this system.
Okay. So the first screen that you will see is the operating budget for expenditures for the FY21. The budget was $4,052,000. We spent actually $3,177,000, so we were actually under budget 22%. Overall, does anybody have any questions? Okay. On the next screen, we will see the revenue collections. Once again, we should be 100% as of June 30th, 2021. We were at 71.6% collected, which were under collections by about 29%. And a lot of this is because, once again, clinics have gone down because we've been in vaccine clinics, and we've been still 1 day a week doing some vaccines and different stuff, and doing outreaches, which means we've got nurses not in the building who are out giving shots.
Are there, let me just ask a quick question. Are there a lot of people still showing up for clinics? A lot of clients still showing up?
I really couldn't answer that question. That's a Donna question, and I don't think she's on.
Okay.
But however, it's really odd because when COVID first started, we never closed down and the people never stopped coming.
Yeah.
But it seems like the past couple of months, they're not keeping their point. They've stopped coming. I'm not sure exactly why now. But
And that's the thing we're working on no-show rate, because we're seeing over time that the no-show rate is was gonna go up. So we try to adapt different systems to see, for example, text messaging, patients to remind them of the appointment. So we're in the process of doing that.
Okay.
okay, so the next slide will show you this year's numbers versus the last 2 years and where we stand. Mostly you'll see that we are immunizations, we are more. The reason immunizations is more is because when we give a COVID vaccine, that's immunization. So we've been giving out lots of immunizations, and we've actually been getting paid for the actual admin of that vaccination. So, and environmental health, you'll see as well as
Who pays that administration fee?
the insurance company. We bill their insurance company. There's no charge to the patient.
So if the insurance carrier doesn't pay, or whatever they have for insurance doesn't pay, then the patient's never billed for that?
Patients never billed.
Yes.
If they do not have insurance, we can bill HRSA, and HRSA will reimburse us that admin fee. But no, the patient pays nothing.
And
Regardless, go ahead. That regardless if they have insurance or not.
The patient pays nothing. The vaccine is free. However, the federal government allows us to charge for the administration of the vaccine, the nurse actually giving the vaccine, at no cost to the employee, no cost to the patient. The insurance is billed, the insurance pays us for that admin fee.
before, I was also going to say, can you also address if in the instance that you require vaccine, you want the insurance, but then you have problems verifying the insurance. Can you clarify that?
If we do have issues with the insurance company verifying the insurance that they have, I have 2 staff members that are currently still working on trying to get the insurance information. But once, like I said, the patient is not billed. The patient, nothing comes out of the patient's pocket. However, I will say this: the reason we charge the admin fee is because the state sends us a consolidated agreement every year. This is DHHS that says we will take every opportunity possible to collect any fee and offset any cost of a clinic. And that is a signed document, and that is law. Any questions? Okay, the next screen just shows you the financials for the ending of the year. Like I said, we were under in collections. We were under budgeted. We didn't spend all the expenditures that we had. So that means if you take those numbers together, we were $173,000 that we did not spend. So what the county gave us for appropriations was $1.4 million is what it took to operate the county in FY21. To operate the health department, my apologies. Any questions? The next slide will show you all the types of funding that we have received from the federal government or state government for COVID. How much was spent and how much is left in those accounts as of June 30th. You'll see that there's two funding sources that still have money left. Those monies were rolled over into the FY22 budget to be spent this year. Any questions on that? Okay, and the very last slide is just kind of what I just talked about billing the insurance companies. The first line is when we were doing testing at the health department, we were allowed to also bill for the testing. The patient was not charged. You see $3,000 there. And for the COVID vaccination, just the admin fee alone, we have collected $31,000. And that money goes to offset us giving the vaccine. So that's $31,000 the county has not have to put into the health department. So. Any questions?
Didn't that administrative fee come up at the last meeting?
Yes, sir. We have talked about it several.
What was decided?
It was decided, I think it's been several meetings back when we actually set the fee. I'm thinking January meeting, maybe. We actually brought the fee before the board and the board approved to charge the fee. So at that point in time, that's what we were doing. And since then, we've been collecting insurance information and then billing insurance, and that's where that $31,000 came from.
But no patients.
No,
patients-
yeah.
No patients ever had to pay that.
Well, I understand that they don't have to pay it, just insurance. Insurance pays it, we're just that much ahead, which is good.
Which is good, yeah.
So, that's fine, I just thought I remembered us saying something else about the administrative fee. Maybe it was something else.
Okay. It was approved. I can't remember. I think it's probably January. I think that's the right meeting. That was approved to do that fee. So the other thing I want to talk about briefly while I'm here is, and I apologize for those of you who are by phone. I do not have it on the screen. I do want to talk just a moment about the mobile unit that is that we are purchasing for the health department. If you are here, then there's a packet on your desk that actually shows you the specs and the actual diagram that is of the mobile unit. This mobile unit has been ordered. Half of the money has been paid down on this unit, which is $83,000. And this was COVID money used to purchase this mobile unit. It does have 2 exam rooms or 2 places to do exams. It has a bathroom. It has a sink. It has a refrigerator. It has another sink out in the bathroom. It does not require a CDL to drive. And we have finally just picked out the colors to go inside, but we're still looking at a time frame of either April or May before this unit is completed. But I did want to give you guys an update on that mobile unit. Does anybody have any questions?
Beth does. She said, are we still moving forward with the collection of insurance for the admin fees for the COVID vaccine?
We had temporarily stopped, but I don't know that I could collect it now in the future because starting September, we're looking at doing a contract with a state vendor, and I don't know that state vendor will do that. So I don't know if they'll actually bill or not. I have to get more information. But as of right now, we are not.
So as of right now, we're not billing the admin fee for the vaccine.
No, ma'am. As of July 1.
So I thought we were required to get every dollar we can get.
That is correct.
So we're not doing it.
We are not.
Well, no, don't, because it wasn't, I proposed that, because of the, when I came first, I asked Dave about, collecting the fees. My understanding was that there was issues with some insurance, and then there were issues that we had, we have collected $15,000. So that was what I was given to me. And then understanding that we need to vaccinate both people, I suggested that if it was okay, like for example, if you are having a problem with collecting insurance information to verify that to get money out of that, or is it a problem for patients if we go to do outreach and patients cannot bring their insurance, then we should think about not collecting administrative fee. But that was when I sent that. I think I sent that to the board, even though the majority say yes. But I think one of the board members objected to it. So I did not develop policy to say we should stop. I said we could, but because of the board did not approve, I didn't get. I think there was one objection. So there was really no policy to suggest that we should stop collecting the insurance information. And I think I repeated that. But again, as Tim said, it is something that we have to look into because I'm not quite sure.
And we have the information on all the clients who's been here since July, patients who's got vaccines since July. So there is a way to get that information if needed.
So based on what the state says, should we not, if we have the information, should we not be billing the insurance carriers for the administration fees still? Should we not be continuing that?
Yes. And that's just the mix up on internally. So we'll handle that. We'll take care of that. That's no problem.
So we will bill what we have.
Yes. Yes, ma'am. I apologize. Yes, ma'am.
No, you don't have to. That's fine. Okay, so that's gonna be taken. We're still gonna collect for it.
Correct.
Okay, especially if we're told we have to do it anyway.
From my consultants from the state, from DHS said that you need to bill because of that one phrase in the law, and also because you need money to offset your nurse's time and offset your nurse's time in the clinic and giving the shot.
And that's true. I agree with that. So you're gonna bill what you have
Yes, ma'am.
and continue to do that until.
Yes, ma'am. We'll make it happen.
Okay.
Nicole has a question. Is this contracted vendor the same one that will be working in the schools or a separate vendor?
This is, trying to think of the name of the vendor, Optum,
Yeah, Optum.
OptiServe, I believe is the name of it.
It's a different.
Is it
I
different?
think it's a different.
Okay.
I think so. It's a different one.
Any other questions? Okay, thank
Thank you
you.
very much for the information. So our next administrative report is the monthly activity summary.
Yeah.
Do we just need to look through that and,
It was
Uh,
included
yeah.
in your packet.
I think I would suggest we just browse through that, and but those are just the monthly summary that we have on the board there, so we can see everything there. And again, that we are working, because one of the things we've been observing is, I'm not sure if it is there, but no-show rate has been a problem, so we are working to address that. And yes, there are areas where numbers are low, it's just because of the challenge we are having with the COVID. So most of the staff have really been devoting their time to COVID. And we thought two months ago we were going to be moving forward, but then when the Delta variant hit, it kind of changed almost everything. So the staff has been really doing a great job with that, at least to get at least 60% of the population vaccinated as quickly as possible. So that just reason some of those numbers are kind of low, because they have, devoted their time on things like that. So this one, I tried to really simplify it, because I didn't want, excuse me, to take a lot of time here, so other people can have the opportunity to talk. Currently, we are having a lot of problems with the for the COVID updates. I think we are having a significant problem with the Delta variant. Now there's an upsurge in the Delta variant. So, and according to this COVID report, as of today, we are the second county in North Carolina that is reporting the highest hospitalization rate. So Scarlet County is really affected by this Delta variant.
So the second highest county in North Carolina?
Yeah, so we are 58, and according to this map, 58, and then Moore County is 60. That's the two highest right now. And I just brought this map here because I think I sent this map before. This is now what we are seeing. So the red is almost every county here in North Carolina is severely affected by this virus. So we are experiencing very high transmission rate. Only one county is insubstantial. So the virus is really spreading faster and quicker in the community. And overall, now the testing positivity rate in the state, for today is 13.5%, almost 14%. And that is very high as compared to the recommendation that at least for community reduction, it should be at least less than 4%. So 13% is almost triple where we're supposed to be. So that's very high. And I think also in your package, we did develop a vaccination requirement with some exception to that. And the purpose for that is one of the things we're looking at is how can we protect the healthcare workforce working in the health department so that we continue to operate. Because you understand that when more people are out, we have really problems doing other things. So how can we protect everybody in the health department? And that requirement, the mandate is in your package. You can review that. And also, just on that, I'll be able to get a little bit more engaged in the community. For example, going to the Aging Advisory Council to present to them, what we are experiencing now in the county, and then volunteering also for the church community services, and also serving as board member, a member on the Scarlet Community Health Clinic. Also had a chance to meet the president of St. Andrew University, where we kind of discussed how best we can be able to collaborate in the county, just in case when students are coming in the new vaccinations, we can be able to do that. Also make the presentation to the Rotary Club almost twice now, and also being able to attend almost every meeting, just kind of be up to date with what is going on across the state and within the local community. So that's been my schedule. I try to simplify it, and I think we do have. This is what we have here. We do have two. Here we go. Open positions. So because I did not want this information to kind of be repetitive, so I left this up to the nursing director and then the WIC director to kind of elaborate more on this. And also, as Tim said, we kind of worked our way out to be able to recommend a request for mobile unit. And the purpose of that, because we were looking at getting at least more people vaccinated. So we thought if the mobile unit can come, we can be able to move faster in the community. But then because of the time, level of time it's going to take to get that, we work our way around that. And there's one retirement, which of course I did not put this on that, but again, I'm going to make a correction to send this over. And again, there's one resignation, and I have to say, I didn't want to bring this up, but at least I have enjoyed working with the person that's outgoing, and she has done an amazing job. I've enjoyed working with her, but I did not want to accept the resignation letter, but again, I have to consider what the person wrote. So that was in that, and I think I did discuss that with you. So going forward, we are actually focusing our attention more on trying to reduce the COVID community transmission, because that's where the problem lies right now. And that's the emergency we are having now. The hospital, the ICU capacity in the hospital is getting to a point. And we have to do everything we can to be able to avoid that. So we've been doing mass vaccinations, mass testing, just to make sure that at least by the end of the year, we can reach at least 60% of the population here who are eligible to get a vaccine to reduce community transmission. I think that's.
Do you know what the percentage is right now?
Yes, so we have 43% who are partially vaccinated, one dose, and then 39% who are fully vaccinated. And that is still at minimum, we set to 60%. And part of the reason is because, when the virus still kind of replicate and then mutate, so when the Delta variant came, it kind of really hamper our ability to be able to move forward, because things that we said we were supposed to move in coming forward, the Delta variant kind of changed everything. So now, and the problem now has been almost 99% of the virus, of the cases are among those who are not vaccinated. So we have plenty of people to get a vaccine, because that's the only way we can be able to move beyond this pandemic. If we were to move, we have to get more people vaccinated, and then to prevent another replications and limitation. I think that's what I have. If there's any questions.
Are the vaccination rates staying about the same, or have they?
It's going up.
Is this going up?
Yeah, it's going up. I think it's steady, very steady going. It's going up because we were in 35%. Now we are at 43% for partially vaccinated, and then we are 39% for those who are fully vaccinated. And we'll be hosting a lot of events in the community. So the staff in the health department has been doing a great job with that. That's why most of their hours is spent on vaccinations instead of doing the things they're supposed to do, because of the emergence of this Delta variant. So most of them have been going out to attend community events to do vaccination. And we're seeing some uptake in the vaccination process.
Are there any questions?
I just want to be clear, is there a mandate who makes that decision for public health?
Dr. Carter, I'm sorry, but whoever's speaking, you're going in and out.
There is a discussion, there was just discussion about a vaccine mandate for the people who work at the health department. Is that in fact a policy, or does that come to the board to be addressed, or what?
Yeah, so we developed that policy as a requirement, and then we bring it to the board. I think it's, and I told my staff that vaccinations requirement will be there. But again, it's up to the board to approve it or to repeat it. But when I stand today as saying it, I think it will be in the best interest to make vaccination requirement for the staff in the health department. But again, it's up to the board to move forward with the policy or to repeal the policy.
So So the recommendation for vaccinations for the health department personnel is, you would like to mandate it for everyone except for those with,
Right, so when we develop the policy, technically, we could use requirement in terms of mandatory, because we make some,
We actually hadn't got to that part of the
that's what I'm
agenda
saying.
yet. That is on the agenda. It's further down.
Okay.
okay,
Yeah. I do apologize.
So that will come up shortly, Dr. Carter, for discussion. So, what's up next is the general department reports. They're in this, handout. So has everybody had a chance to review that? And is anybody gonna report on their department, or this is a summary for us to review? Is that correct?
Yes.
And so in the department review, I'm making the assumption that all the departments are moving ahead, looking at, recertification, re-credentialing with the credentialing body. They're making sure everything's up to date with that moving forward, because you don't want to come up at the last minute on that, even though it was just done not all that long ago.
right.
Any questions? All right. And is there any unfinished business that we need to address? Sherry?
No, ma'am.
Okay, moving forward to new business then. So, Tim is
Yes.
so what we have are, the, lab price increases for, it looks like the rabies titer and that sort of thing, and then the, fee schedule for 2022. And I think we could, make a motion for those together and maybe include, can you share about the approval for new funding?
Yes, ma'am. The $115,000 is a new funding that has come this year from DHHS. This money is being used to hire a public health school nurse liaison. Basically, what this public health nurse will do would be coordinate with the schools, the county school system about vaccinations, testing protocols for what happens when students go back to school. So that is something that the legislator has passed in the House and Senate and has sent to us in the monetary terms to hire 1 or 2 public health nurses to be liaisons with the school system. So I do know Donna has been in contact with Jamie signing at the schools and some other people at the schools. So that contract is being worked on about who's actually going to do that hiring, who's going to actually have the purpose of that nurse. Where that nurse is going to be housed, which probably housed at the school system. So once again, that money is just earmarked for that specific purpose only. That specific purpose.
How's the school system feel about that? Do you have a feel for it?
I can only tell you the email I saw from Jamie was yes.
I would think that would be
That's all I
delighted.
said.
Right.
Yes, this is great. That's the email I saw. So
Okay, I think that's wonderful. So that's a good explanation. And so, so I think we could look at the approval for lab price increases and the new fee schedule for 2022 and approval of this funding. Could we make a motion to approve all 3 of those items? Does anybody have a motion? Would anybody make a motion for that?
I make a motion to approve all.
Okay,
Second.
Nicole
Second.
and, okay, so we have a motion and a second. Everybody in favor, pretty much? It's hard not for people to know about that. Okay. Sharon, what did you hear over there? I saw you. Okay. And the next item down on the agenda is, approval of new policies and regarding the COVID-19 vaccine requirement that we just briefly talked about and tabled to right now, and then text messaging. So, Eli, do you want to discuss that?
Yeah, so we have two policy here. One, of course, is the text messaging for us to be able to remind patients of their appointment. And one of the reasons for this is we've been saying low attendance, patients not keeping their appointment. And the question has been if we are working and patients are not keeping their appointment, then we may not be able to generate the revenue we're supposed to get. So we are trying to work on it to fix that. At least the text message would be, and it's going to be HIPAA regulated to remind patients of their appointment. None of their, besides texting them, but none of their medical information will be disclosed in that texting. And the most important one is the COVID vaccine requirement. So my understanding is, according to what I learned, we have 43% of our staff who are vaccinated. And the problem I have been struggling with is when somebody get exposed to the virus, the end of the department, they have to stay home. And considering that we are understaffed, it kind of create burden on that particular department. Some, they have to stay home for a week or two, and that particular department can kind of struggle. So my suggestion we develop a policy that, and also looking at the transmission rate, and also looking at having a health workforce to be able to get everybody fit to work in the health department, we may need to require vaccination. You prove that you are vaccinated if there will be exceptions. Medical exception, if your provider says you can't take the vaccine, you can't take it. And there will be a religious exception. Based on a religious view, if you can't take the vaccine, we understand that. But the requirement would be either you show proof of vaccine or you get tested every week, weekly testing. And the purpose for this is actually to not get a cluster or outbreak in the health department. And as I said previously, my number one priority is to protect the health department workforce, because I need to have a workforce that is fit and functional and ready to do the work. And looking at this Delta variant is very, very complicated because of the high transmissibility of this variant. So the policy is we need to get our staff to get a vaccine. And again, we've been looked at as the lead in the country here. So other practices are looking up to the health department. They want to see what the health department is doing. So we have to set that tone, and in public health, that this is what is required if we were to move beyond this pandemic. So, but again, it all comes down to really, really protecting the workforce and the team that are working in the health department, so they be able to do their job without any obstacles or challenges in terms of the Delta variant.
Okay, so let's start with the text messaging for reminding patients about their appointments. So let's take that one first. So it's in our packets here, and I think everybody got it in the mail. So text messaging for public health messages and appointment reminders. Is there any discussion about that? Any questions about that? I think probably most offices in the area do text messaging for appointment reminders, except for my office, because there are certain reasons we don't do that. But would that be an issue for anyone? Is there any comment about the text messaging or questions about it?
Sounds like a good idea to me.
I move we allow that or adopt that policy. He's already said that it will be HIPAA compliant.
Yes. Okay, is there a second for that?
Yes. Second.
All in favor? Anyone opposed? Okay, we will adopt the text messaging policy. So moving on to the COVID requirement, is there any discussion about that?
Absolutely.
Absolutely to move forward with it?
Absolutely, there's discussion.
Discussion, I believe.
Okay,
So it's not a motion on the floor at this point. It's a proposed policy. I guess we have to have a motion to make it a policy, and then we can discuss it.
okay. Do I have a motion to make this a policy?
Go ahead.
Okay. Second? Okay. All right. Anybody, all in favor of this?
No, you have to have discussion.
Okay, let's have the discussion about it then. So, Dr. Carter, do you have some discussion you would like to bring forward to the, board? about this?
Absolutely. I'm going through this in 2 different locations, actually 3. If you take, my daughter-in-law is employed by Duke. I'm employed by North Carolina, and we're talking about it at the hospital.
Yes,
There's already some, there are legislators, there's letters that came out from the legislature about collusion of the major medical employers as this being an unfair labor practice. Now, all the medical centers got together, did it at the same time, so the employees don't have anywhere else to go. It's just the same thing as fixing their wages.
yes,
And they did the same thing in Charlotte with all the major medical groups, and that put us in that boat. Now, what's happened with regards to the exemptions, this is very, we get really careful about how we ask questions because of medical legal issues when we're trying to hire someone. So, who is going to decide what religious objections are worthy, and who's going to decide what medical exemptions are worthy? This gets to be a very sticky wicket. And how many employees are you going to lose because you forced them to get vaccinated? I don't remember I couldn't hear the number of employees that are vaccinated. And then you have to get to the science. And the science suggests that the vaccines, first of all, are very leaky and increasingly leaky with each new variant. We have Lambda on the way. I think it's a misconception to think that if everyone is vaccinated, we're out of this pandemic. It takes a couple of months before you develop that strong immunity from the vaccine. By then, this Delta wave will probably be past. We may be in the Lambda phase, maybe a new that's less affected by the vaccines. And so it's a timing issue. It's a Me Too jump on board with what I believe is not a productive policy. Just because Joe Scarborough or Hannity or some TV pundit or the editor of the Larberg Exchange says the vaccines are safe and will get us out of the pandemic does not mean that either of those things is true. The adverse events are only being reported voluntarily. There's no mandatory reporting of vaccine adverse events. This is the first time a vaccine has ever been introduced without mandatory reporting of adverse events. So we have no idea. I think they're not as dangerous as some people think they are. I don't think they're safe as the publisher of the editor of Larberg Exchange thinks. So I just think the timing is crazy. It's not going to work out. You're going to lose more employees trying to make them get vaccinated. And there's no one who's going to sit in judgment of people's moral and religious objections to the vaccine.
Couldn't they all move like the schools? This is how we're doing it there. We're finding out if everyone is vaccinated. Depending on that, they don't have to get vaccinated, but they have to wear masks and get tested weekly. So that's the phase we're in. So it's like a lot of people don't like that either, because it's like we're forcing them to get tested.
Okay, well, a point about the testing, we know that people who are vaccinated carry the virus. Other people who have had COVID carry the virus, all these folks can carry the virus and give it to others. So if we're gonna test everybody, we need to test everybody every day. And at some point, it becomes a little bit absurd. The vaccinated person is more likely to be asymptomatic and carrying the virus and undetected than the symptomatic.
How do they do the flu vaccine? Is it still mandatory, or is that a choice?
It's a
Like
choice.
it's hospital? It's like a choice too.
Yes.
It depends on it depends on the practice. Some medical practice can mandate the flu vaccine for their employees. And also there's a religious exceptions, there's also medical exceptions. But if I can weigh in, I think it's Dr. Carter was the first speaker, right? If I can weigh in on that, I do understand your concern, Dr. Carter, but what we have seen actually with the vaccines, these vaccines are not experimental vaccines. The mRNA vaccine has been in production for about 20 years ago. So it's not a new technology. It's just an improvement that has been made to utilize this technology to prevent COVID. Now, when COVID started, there were a lot of trials with vaccines, a lot of them with the live virus, with the inactivated virus, and with the mRNA vaccine. But the mRNA vaccine came on top, and that's the reason why it was recommended. So these are not experimental vaccines. They are real-world vaccines because they were tested, they proved to be effective, they proved to work to prevent COVID-19. Now, I do also understand the concern that we are not forcing individuals to take the vaccine. We say it's a requirement, and we did make suggestion to that. And if it's like any other vaccine in other practice, employee can require you, for example, to get a TB test before you even start work. That's a requirement for that. And this vaccine, I know there are a lot of misconceptions that you take the vaccine and then you get exposed to the virus. That is expected because we do know for sure vaccines have never been created that can be 100% effective. So these vaccines are almost, we get 96% efficacy rate, and then we have 94% efficacy rate. So these vaccines are highly effective, and they are proven. We have seen a lot of studies from the CDC and other partners that show that these vaccines do actually prevent the virus. Even they are highly protective against a new variant. It is possible that you can get breakthrough cases. That's possible with any other vaccine. But the question is, how severe those breakthrough cases are going to be? And we have seen with these vaccines that even if there are breakthrough cases, people who are vaccinated and get a virus, the severity of the illness is minimal as compared to people who are not vaccinated. And again, in terms of public policy to protect the workforce, I do believe this is the right policy to go by. But again, it is when you look at the efficacy rate of these vaccines, if you look at the benefits of these vaccines, and then you look at the cost of not taking the vaccines, the science has pointed to the fact that the benefit do outweigh the cost. So again, we are recommending, this is a public policy, but we are recommending people to take the vaccine. We are not trying to force people to take the vaccine. But as a public health professional, as a public health, somebody who was working in this public health field, we do believe that these vaccines are safe, these vaccines are effective. I think these vaccines can actually help us go beyond this pandemic. And that's what we are asking the public to do. Because now we have a lot of people who are in the ICU because of this Delta variant. And by the time you are in the ICU with this virus, the vaccines are no longer useful for you. So the purpose of these vaccines are to protect you in the first place from getting it. And if you do get it, is to protect you from getting severely ill or even dying from it. So that's the purpose. We in public health are encouraging, and we highly encourage people to get this vaccine because they are proven to be safe, effective, and they work.
So I understood that this was a mandatory requirement unless you had a religious or a medical exemption.
Right. So we do. We do have. We do have.
Is that policy?
Yes, we do.
Now you're telling me it's not going to be mandatory.
Well, it's a requirement. It's a requirement, right? That we do exceptions and a requirement. You can say this is required, but there are exceptions. So that's why with this policy, we require it, but there are exceptions. If you do have a medical problem, your provider say, hey, you don't have to take this vaccine. We understand that in public health. We cannot offer something where the provider against the provider's will. If you have religious, we have a way to understand that. This is not really my first time dealing with vaccine. We dealt with polio. Polio was a problem for the world. People didn't want to take the polio vaccine because the fact is, same way today, we are feeling against the Delta variant. Now here's what happened. Polio has been almost eradicated from the whole world because of the vaccine. Only 2 countries today, Afghanistan and Pakistan, has a strain of polio. So there are always going to be vaccine hesitancy, no matter what you think. But with this vaccine, actually, we have seen it works. So we say it's required, but we make exceptions for the employees to be able to waive those exceptions. And overall, I think even the Department of Health and Human Services now is requiring their employees to take vaccines. The military by September 15 will be requiring their forces to take the vaccine. So this policy is not alone in Scotland County, it's everywhere. Again, it all comes down to, are you going to protect your workforce or are you going to make your workforce vulnerable? And if you make the workforce vulnerable, we are working in public health, we will have to feed that, because when people get sick and get out, we have to allow them to quarantine or isolate for the number of that is supposed to be out. And the department the work for that department is going to slow down because that person is out. To prevent that and get a stable workforce and get a productive workforce, it is highly encouraged that we get this vaccine in people's arms.
So, Dr. Carter, you sit on a lot of committees over at Scotland. What's the hospital's policy on the COVID vaccine for employees at this point?
There's no mandatory requirement of this sort. There's no mandate for vaccines at our hospital. There's not one in Florence. There is one in Southeastern. There is not one at more regional.
Yeah.
And in North Carolina, it's sold as a mandate and it's administered as a suggestion, meaning there's no religious exemption, no moral objection that is not allowed.
So you're saying in North
I
Carolina?
presume that's going to be the same thing everywhere else. Who is going to sit in judgment for someone who says, I have a moral conviction and not taking the vaccine?
Yeah.
And that's what a lot of it is. It's not fear, and I beg to differ. There's never been a vaccine that was under emergency use authorization that was mandated anywhere until this one.
Yeah.
I have a question. If I have a question, I'm not expert in virology, but here is my point, and I would like to have an answer from a specialist. What's the most effective way to make the public safe? Is it vaccine or mask and testing? What's the most effective way?
Well, according to what we are seeing, not just here in Scotland, but across North Carolina, across the United States, and globally, the vaccines have worked. The masks are substitution. You wear your mask, you wash your hands, but the contingency of this virus. Now, here's the thing: we should all understand that this virus was reported in 122 countries. That's the reason why first it was considered to be a pandemic. So the best option now for this vaccine, and another thing we could be looking at is, should we allow this vaccine to replicate and then mutate? There is a chance that when more people are not vaccinated, even if you wear a mask, even if you wash your hands, there is a chance that this vaccine can replicate. That's what we're having to find in this new variant. The more the virus stay in the community, the highly likely it's going to replicate and then it mutates. But if we do have a lot of people vaccinated against the virus, we are moving towards that, avoiding replications and mutation. And if more people are not vaccinated, there's a chance that we may get a variant that might be even contagious and deadly than this Delta variant we're having now. So the vaccinations right now for this Delta variant, I mean, it is the best choice to go. It's the best choice to go.
So, according to the policy that's been put forth, basically unvaccinated employees with a documented exemption at the health department we'll have to follow basically, the same guidelines that we're doing right now, which is they must wear a face covering in common areas. You, outdoors, I guess if, unable to socially distance, you'd have to wear a mask. And then unvaccinated staff would be required to be tested weekly for COVID-19. If you have a copy of the policy proposed, that's what it says for unvaccinated employees. My understanding is that.
Wait,
Go ahead.
where is this policy?
It was in the, packet that was mailed, to you. It's, in with that material. So my understanding, just at Scotia Village, for example, and I think I'm right in saying this, so just another facility in the county, I think 100% of their residents are vaccinated out there, and I think they're at about 75% for their staff. Unvaccinated staff at Scotia Village are required to test every 2 weeks. They're required to test twice a week for COVID. So that's the policy at another local facility in the area. It sounds like there's a lot of concern about this policy as it stands. Is it something you would like to look at more and table until our next meeting, which I'm thinking we're going to have a call meeting in September? Is that something you'd like to table, or is there more discussion about it? Is there more concern about this policy as it stands for the health department?
So are you telling me the policy is now a standing policy, or is it?
No, as it's proposed,
Policy?
as it's proposed, basically. It's a policy proposal from, the health department director. Do you have a copy of it that you can refer to? It's a proposed policy, just like the text messaging. It's attached to the text messaging policy that was proposed. So it's attached to the back, so you might not have noticed it stapled together.
Diane, you mentioned tabling it till the next time. It seems like we just about got to table it the next time, so people will know more about it and at least feel better about their decision. I think we should have it, but at the same time, I'm just concerned about our country and the spread of this virus.
So Mr. Todd has said that he has concerns, and perhaps do you want to make a motion that we table it till the next meeting, Charles?
Well, it looks like we should, because it's going to be hard to make a decision. If you wanted to have a vote now, I'm for having that, but I don't want it to sound like you're forcing anybody to have that shot. Maybe requirement is not the word if somebody thinks that they're going to be forced to do something to keep their job. And if a person's against the vaccine and they're also against being tested, now that's ridiculous. That's just political. That's just saying, I don't want to do it.
Is there any other discussion?
Yeah, I feel like, the medical and religious exemption, like the ones that's not vaccinated, they should wear the mask and be tested. But this is saying you have to have a medical and religious. So that's just saying you have to be vaccinated. So I know, like with the schools, they mandate it, but we don't have to have the medical or religious. You just have to wear the mask. Well, we have to wear the mask anyway, but you have to get tested. But you don't have to have a medical or religious exemption. So it's still
So
like-
basically, you're saying that the school system, if they have not had the vaccine and they don't want to participate in that, they just don't have to, they need to practice, basic, protocol that we have now, wearing the mask.
Yeah, you have to
and
get
social-
tested. Yeah, I think it is weekly.
So,
Weekly
so,
or every 2 weeks, but they don't have a medical or religious exemption up there.
so in this policy, and you probably have that, Nicole, in this policy, it says that they must comply with the vaccine requirements, and they, must submit the evidence of their vaccine, and also if they are requesting a medical exemption or an approved religious exemption, they must, turn that in by a certain deadline. So this is a little more formal than evidently what the school system's using. So,
Yeah.
is there any more discussion about it? Is it something that the rest of the board members feel like we need to move forward with tonight? Or is there more discussion? You'd like to look at the policy a little more in detail? I do anticipate there will be a call. I do anticipate there will be.
Move table.
Can't hear that.
Dr. Carter said he moved to table it.
You're what?
He moved to table it.
So we have a motion to table this till our next meeting. Do we have a second?
I'll second.
Okay,
I second.
all in favor? Any
Right.
opposed?
Aye.
Okay, we'll table it to our next meeting. Just so you know, I'll just bring this up. I anticipate we'll have a call meeting in September. So, you might want to just, go ahead and kind of pencil that in on your calendar. I don't think we'll be able to wait till October for some other business that we need to do. So, just anticipate a call meeting for, next month. So we will table this, and we have approved the text messaging policy. Okay, any other comments? Okay, so moving through the agenda, just a discussion about the board chair and the vice chair appointments. If you've looked in and I don't know that you have, because I've looked through the, handbook that we get for, being a board member, but, Mr. Davis served for a long term as the board chair, and, I'm assuming that's because nobody else wanted to serve as the board chair, so he just continued, and I think, according to the handbook, just for informal discussion here, just FYI, a chair and a vice chair should be elected annually to the Board of Health. And basically, that will be coming up towards the end of the year, so just so you know that will be in the works over the next, and we'll discuss that more at the next meeting. But you have the article in your information for the meeting tonight, Article 4. There's some additional information in Article 8 as well, I think, that you might want to review. So we'll bring this up probably at the formal October meeting about how we'll move forward with electing a new chair for the coming year, effective in January, and a new vice chair as well. So just have that in the back of your mind. Any questions? All right, any other discussion about any items at all? If not, if there's no, yes, Tim?
Yes, Ms. Bean. I would like to clarify a statement I made. I made a incorrect statement, Dr. Carter. Us billing for the phrase that's in our consolidated agreement is not a law. It is a recommendation for us to receive federal funding from that source. So once again, I misspoke. It is not a law, and I want to correct myself on that.
Thank you, Tim. So if there,
And I want to make a statement too about my opinions about the vaccine. I really think that many adults should take the vaccine. And I'm pleased that most of our elderly are protected. I think as you go younger and younger, that it's definitely a risk-benefit calculation. and we don't know what the true risks are. We know that myocarditis in the adolescents. I will stand in front of anyone trying to vaccinate my grandchildren who are all under 13. I think the science is poor, and the science is good. It does, in fact, reduce the severity of disease in the older patients who are at risk. And somewhere in the middle age group, that we cross that line where the benefit outweighs the risk. But we don't even know what the risks are, and it's under emergency use authorization. And most of the folks at the hospital are unwilling to approve mandatory vaccines while the vaccine is under emergency use authorization. So I'm not an anti-vaxxer. I think that people that need to be vaccinated, but not everybody needs to be vaccinated. It's not the solution. Therapeutics are the solution. Not widely distributing ivermectin is a huge problem. It's cost a lot of lives, and the resistance to it has been just so irrational.
Thank you, Dr. Carter, for sharing that. There are a lot of very good points in that, and I think we all realize that the people that are at risk, at high risk, especially our elderly population and those with chronic disease processes, are at very high risk. So there is a part of the population that does need to be vaccinated, and there's some gray area there, so I agree with that. So thank you for sharing that. So if there's no more discussion or informal discussion about any items, we need to move to a closed session. Do I have a motion for that?
Go ahead.
Okay, second? Okay, Charles. All right, we're gonna move into closed session.
We want to ask those who are not Board of Health members to end the call.
Sharon, can you disconnect them manually or not?
Yeah.
Okay. So we won't have to bring